Pause. Silence. Let's reconvene in person again to reconnect, to tell our stories, to listen, to disarm ourselves of preconceived notions, to reframe, to reflect, to unplug. Welcome to #Unplugged22. Take a victory lap. High five a friend. This is your moment, our moment. Together, we unplug to connect again and remember why we started. Let's evaluate our community and our digital impact with quality conversations rooted in context. We're about real connections that translate into real-life action. Brought to you by Jam Lab Africa and the Civic Tech Innovation Network.
Hello, everyone. It's such a pleasure to be here facilitating this session. I am Eliana Fram, Economic Prosperity Officer at Solve, an initiative of the Massachusetts Institute of Technology. Solve's mission is to drive innovation to solve world challenges. We see ourselves as a marketplace for social impact innovation. We find, fund, and support incredible social entrepreneurs who are working tirelessly on innovative solutions around the world. We call these social entrepreneurs solver teams. And recently, last month, we presented to the world our 2022 class 40 amazing entrepreneurs who are working with Indigenous women, blind and visually impaired students, conflict affected countries, and other underrepresented populations across the world using artificial intelligence, big data, video games, but also ancestral and indigenous technologies. In this context, I have the immense pleasure to have here three of our inspiring 2022 teams to share about their experiences, their work, and their impact. After this panel, we'll open up for some questions from the audience, and then we'll go into breakout rooms where you'll have the chance to dive deeper into their work and keep this conversation going. But before we get started, I will ask our panelists to introduce themselves and their work. I will start by Zenith, and then we can go to Jonathan and Francis.
Thanks, Eliana. Hi, I'm Zina. I'm the founder of Dummy Life, based in Cape Town. We facilitate care coordination for people that can't care for themselves and uplift Black and coloured health workers and family caregivers with tools and training to deliver high-quality home-based care, hopefully thereby transforming them into valued members of the workforce.
Hi everyone, my name is Jonathan Mackay, but you can call me Jono. I'm talking to you from Pretoria, South Africa, although at 4 a.m. this morning I was in Nairobi, Kenya, so I'm not really sure where I am at the moment. I am the founder and executive director of a tech nonprofit called Same that was founded to find ways that digital technologies could support LGBTQ plus youth across Africa. Nice to be here. Thank you for the invitation.
Hi, everyone. My name is Francis. I'm a teacher by profession, and I'm based in Uganda and a curriculum designer at Learning Equality. Our solution is Offline Squared, and it is focused on tech-enabled project-based learning that is hands-on, but the internet to support low resource settings. And we are piloting this solution with a project called Flying Colors in Parabek refugee settlement in northern Uganda. Thank you. A pleasure to be here.
Thank you. So we'll get started with an open conversation and some questions for our panelists. But people from the audience, please feel free and encouraged to put any questions that you have in the Q&A chat on your right, and we'll address some questions at the end of the conversation before we go into the breakout rooms. I'd like to start us off by talking about the human-centered design aspect of social innovation. This approach puts real communities at the center of the process and allows us to respond to a concrete need in a way that can only be achieved by being in the community or in close proximity to it. So I would love to hear about how the process has been for you. And we'll do the same order. I will be starting by Zenith, and then we'll turn into Jono and Francis. So how did you identify the need, and how did that turn into a solution?
Thanks, Aliana. I'm building Jummy Life to be the solution that I wish we had when my grandmother was still alive. She was bedridden for 16 years. She suffered several strokes, heart attacks, lived with diabetes and breast cancer. My cousin, who's 2 years older than I am, took care of her, along with other family members, and I worked to contribute financially. No one had the expertise, and it caused a lot of tension in our family. I know that this challenge is not unique to ours. Thousands of families have similar, and family members, often women, stay home as care providers, perpetuating unemployment, and also, continuing this underlying tension around family responsibilities, etc. So we started with a tech solution that was designed around the patient, visualizing metrics with the intention of identifying risks earlier so we can support decreased rates of rehospitalization and so on. But very quickly realized that this doesn't work for the care providers and for families, and it doesn't address the significant gap in knowledge and expertise that family members and care providers have. And so we refocused to make sure that we're sufficiently training and developing that expertise alongside a technology solution to support families, care providers, and ultimately that will improve care provision for patients. We realized very quickly that to serve patients, we need to make sure that the care provider is well taken care of. And that there's training resources and so on, but also that they're paid. So even family members who provide care can opt in to get qualified and then provide care on an hourly basis, and we pay them to do that. And they have access to training and tools that support messaging and care coordination, so that everyone knows what's going on. And we support that process. We help when there's an intervention that's necessary. It's always better if it comes from an outside, from a physiotherapist and so on, versus from the care provider who may not have the language or the negotiation skills to do that.
Thank you. We'll turn to Jonah now.
So, Eliana, I'm a huge believer in the power of human-centered design to uncover both universal truths about everyone and also very particular, highly localized challenges and opportunities. And I think if anyone is serious about taking a human-centered design approach to addressing the needs of a community, then you're going to need to embed yourself in that community, trying as best you can to shake off the preconceptions you've inherited and built up over lots of years. I don't think you necessarily have to be a part of a community to solve problems for a community, but it's a huge, massive, gigantic advantage if you are. Same was founded because in over 70 countries all over the world, most of them in Africa, private and consensual same-sex activity and different forms of gender expression, how we dress, move, and talk, those are criminalized, creating a really hostile and scary climate for young people who feel different and who are trying to figure out who they are. The result is that LGBTQ plus youth suffer from mental health challenges at far higher rates than their peers. In South Africa, young gays and lesbians suffer from depression at 4 times the rate of their peers. But our team, the team at Same, didn't need to do a lot of research to know that, because over 80% of our team are members of the LGBTQ plus community from the global south. We know what it's like to grow up being afraid of who you are, being afraid of your identity being discovered or disclosed by someone else. And we know what it's like to be dealing with mental health challenges later in life because of experiences in adolescence and early adulthood. That's why our team has come together to build something that we wish we had when we were younger. But even though our team is representative of the community we're trying to serve, that doesn't mean that there isn't something to still learn from human-centered design processes and working with the community, because we're not teenagers anymore. We're not young adults anymore, a lot of us. And we've made a commitment to be a youth-led organization. So we've put human-centered design at the forefront of just not how we design our product, but how we design our organization. Every country that we work in has a youth advisory panel that consists of young people between 18 and 24 who are representative of the community that we're trying to serve. And we're talking to them on an ongoing basis about things like compensation. I was really interested in what Zenith was saying about making sure that carers are paid. We want to be recognizing the contributions that young people are making when we engage with them in human-centered design processes. And I think that's a very important part of doing human-centered design well. How do you actually make the experience beneficial to the community that you are involved? How do you make sure that it isn't exploitative? We are not getting it right all the time. It's a journey that we're going on, but one that we've made a commitment to stick to.
Awesome. Thank you, Jono. And lastly, let's go to Francis. Same question.
Thank you so much, Diana. I'll speak to our solution, which is really focused on solving the challenge that was brought on board by the COVID-19 pandemic, where we had a school closure in Uganda for almost 2 years and a half, and we had registered high levels of school dropout. And by the time the schools opened, most of the children were not motivated to come back to school. The young girl child had been victims of early childhood pregnancy, and we wanted to put together an innovation that would attract them and interest them to return to school. So as we pondered around what the innovation should look like, we looked at things like approaches like project-based learning, playful learning, and these could help. But there were not enough resources for teachers to teach these types of classes or for students to learn. And while otherwise the internet is also a very difficult resource to access here in Uganda. So looking at these challenges that were surrounding the type of audience we are looking to innovate for, we also had to bear in mind that this is a group that has gone through some emotional stress and we needed to also look at their social emotion stability. So our innovation was put together by understanding all these needs, and we decided to pilot this offline squared solution that brings together project-based learning, playful learning, social emotional learning, which turned out to be interesting for these learners because they were interacting with resources that we put together on our platform that helped them to really think through the challenges that are facing their communities, challenges they go through on a daily basis, and attracted them to come back to school. And how does it become to be human-centered and design about the people? Is because learning equality is using at learning equality we are using already an existing tool called Colibri, which works without the internet, and that means we can gather resources, we can gather content, put it together, and then our learners can access it offline using the gadgets that we have provided, of course, with support from different stakeholders that we are working with. So our pilot program is a 1 year where learners have access to project via technology, tapping into resources that we have put together from Colibri. And one of the major hopes, the important hopes that you have is that by the end of this program, these learners are going to be motivated to enroll back into formal school. And how we have been able to arrive at this is by putting consideration all the stakeholders that are in the community that you are working with, the people who are taking care of these children. So we have worked with partners like the Office of the Prime Minister, organizations like Amal Alliance, who have put together the social emotional learning curricula, and then also working with organizations that are on ground, that have lived with these learners and understand them better, like HAF, who are implementing the project, who took time to hire, to recruit the teachers to implement this project. And this very well aligns with learning equality's general approach of designing technology, which puts people and their needs at the center and focused on equity. So as we have been developing this pilot in Parabek, we have engaged a lot in community mobilization and talking, engaging, implementing partners to continue to understand the needs of our learners, basing on the fact that they had been out of school for a very long time. So by working with the community and other research partners like Innovation for Action, we we are taking an iterative approach to develop this solution so that it continues to respond to the community needs as we continue to pilot. Thank you so much.
Thank you, Frances. I am learning so much already from all of you. And we have been talking about human centered design, a major component to all of your approaches. And the other component I would like to address is innovation. So, when we think about innovation, we often think about technologies that are dominating the public conversation, like machine learning or robotics, for example. However, innovation can also be a new application of an existing technology, a new business model, or simply the approach taken to solve a problem using technology as an enabler rather than it being the protagonist. So, Francis, I'm staying with you, and this is a question for you as well. Could you share a little bit more about your perspective about technology and which role it has in Colibri?
So at Learning Quality, we believe that technology as an enabler provided that is being developed in an equitable way. Because at Colibri, when we look at Colibri, our main platform that has all the resources which have been from different contexts across the globe, it has been designed to be flexible so that it can be contextualized to fit a target group. And in this regard, for this solution, we are taking the existing Colibri platform that Learning Equality has developed and then developing a new curriculum that is specific to the project-based learning with this particular approach, using play-based approaches and incorporating social emotional skills development. So we are also developing new training materials which are specific to this approach that would probably support the use of technology. And of course, we'll be making changes to this platform that respond to the needs of particular use of different learners as they come, because we are able, or a teacher who is using this approach is able to see how the learners are interacting with the resources on their Colibri, on their tablets, and they can tell who is struggling and who is not struggling, and they can walk to them and give them feedback and support them to improve. And of course, on my end, as a curriculum designer and someone who has been working with teachers previously, I go to Colibri, the main platform, then I look at these existing resources, see what we have to ensure that is this curriculum is being developed. So I look at these resources and then I try to contextualize them to fit our setting, the settlement setting. Now, by putting together this curriculum and then looking at aspects like project-based learning, taking care of playful learning, taking care of social emotional learning, and ensuring that the learning is as interactive as possible, it has helped the learners to view this kind of learning not like the traditional one, which used to be teacher-centered. So the learners now are looking at the classroom setting as a safe space for them to interact, to ask questions, to share their opinions about different aspects of life, about what challenges they are going through in their communities. And you'll be surprised that now the learners themselves are thinking critically about what they can contribute to their project, about how they can be change makers in their society. So with project-based learning, these students are becoming like critical thinkers, problem solvers, and this has helped us to realize how these learners can participate in being change makers in their community. And when I really want to resound that technology is being enabled by our approach by application, these learners have become excited because the resources they interact with are resources which have probably been developed by learners from different countries, different contexts. And when they are going watching these videos on their tablets and learning and trying to apply the knowledge, they are identifying with peers, with learners of the same age that they watch doing these things, and they want to try it out because they are motivated. They know that it's someone somewhere of their age who is doing this. So the other thing is that with Colibri, the teachers without Colibri, the teachers would not have had access to these resources. So, but now they are able to log in to lead these classes, and also students are able to access these resources without requiring to connect to the internet. And what is most exciting for me is to see that, for example, Kampala, the capital city of Uganda, what learners can access in the city is the same resource that learners back in the remote areas in refugee settlement can access offline. So this makes learning equality is developed collectively to provide the same type of learning experiences for learners in different contexts, paying attention to low resource settings and also high connectivity settings, bearing in mind that in Africa and specifically in Uganda, internet is a very limited resource. So when learners access these resources without requiring to pay for internet, it is becomes like an exciting thing for them. And the parents are so excited because they have been part of this journey. And I would like to conclude by saying that in this way, not only technology is an enabler, but it is an equalizer because it can bring the child in a city where I live in Kampala access the same resources with a child who is up country. Thank you.
Thank you, Francis. And totally agree. Technology is so powerful, no doubt about it. And I'm glad you brought up the point about contextualization and how malleable technology as a tool is with the right approach that allows us also to democratize access to other resources rather than technology as a resource itself. And that's a great stepping point for our next question. And for this, I would like to turn to Jono. Many gay, bisexual, transgender, and queer youth face threat of discrimination and violence, and this can be profoundly harmful to their mental health and their resilience too. We all need to be safe and supported to be who we are. So, Jono, can you tell us more about how technology enables same to have an impact on the LGBTQ plus community?
Thanks so much for that question, Eliana. I also just want to quickly give a shout out to Francis for incorporating social and emotional learning into his program. I think it's part of a growing awareness across the social change sector that actually mental well-being has a huge influence on your ability to learn, to earn. And unless we are addressing mental well-being among young people, then we're limiting their potential. And what Same is trying to do is to make sure that through technology, we can make sure that young LGBTQ plus people have the same chances to achieve their potential as everyone else. When it comes to mental health in Africa, any kind of service is difficult to access. There simply aren't enough trained counselors or trained therapists anywhere in the continent. This is a particularly acute need after COVID, where many people are dealing with the effects of being in lockdown, of losing jobs, of seeing family members die, of dealing with the uncertainty of these crazy times. So there's an explosion of mental health challenges across the continent, not nearly enough people, not nearly enough healthcare workers to respond to this crisis, especially for young people who are questioning their identity. Navigating adolescence and young adulthood is challenging enough for anyone. But for a young person who is questioning their sexual orientation or gender identity, it can be particularly difficult because they're afraid to reach out for help and support when they need it. So even, I've said there are very limited mental health services to access in the first place, but those opportunities are even fewer. There are even fewer services if you are questioning your sexual orientation or gender identity. In South Africa, where I'm from, a survey from 2016 suggested that over 50% of all health workers thought that lesbians and gays were disgusting. Which is a reflection of prevailing attitudes in a country that, despite a progressive constitution, still has a lot of challenging views around sexual orientation and gender identity. And that means that there are fears of stigma and discrimination that keep young people from accessing even the few services that do exist. Now, technology. I think a lot of people have suddenly realized that technology might have a role to play in expanding access to healthcare and expanding access to mental health care. And if you are lucky enough to own a smartphone and be able to get onto an app store, you can download a number of different apps and services that are designed to boost your mental well-being. Those apps and services are made for smartphones, for high bandwidth connections, for highly educated people who are predominantly English speaking and who are very familiar with the terms and concepts of Western media. They are not designed for people in low resource settings, the kind that Francis was talking about, where people have very basic phones, where they're on prepaid contracts, where every single little byte of data costs them something, where people have phones that because of the limited memory don't support lots of new apps being downloaded even if you did have the bandwidth. So one of the innovations which same has tried to bring to the space is to say, where are young people now? What digital channels are they using? And across the continent, young people are using WhatsApp. This is not true, of course, for everyone. There's still a very significant portion of young people across Africa who don't even have access to WhatsApp, but it is now the most widely used chat platform that the continent has ever known. So instead of trying to build an app, we are delivering a solution via WhatsApp. We're taking an 8-session cognitive behavioral therapy course that has been proven to be effective in supporting the mental well-being of queer youth in North America. And now we're working with young people in South Africa, in Zimbabwe, to find ways that 8-session intervention can be adapted so that it can be delivered through WhatsApp, through the devices that young people actually have access to, in their language and in a way that resonates with them. Too much of the discussion around mental health and sexual and gender identity relies on quite sophisticated concepts. Like, it's not enough to say, hey, gender is a social construct. Be comfortable with who you are. What does that mean to a young person living in the slums of Nairobi or the slums of Kampala? So a lot of the work that we're doing is trying to take the technology that's already there, the interventions that are already there, and adapting them so that they can actually be reached by a much larger group of people. And we think that's our contribution to creating more equitable health systems, using technology, the existing technologies, to take proven interventions to more people.
Thank you, Jono. Thank you for sharing that with us. Makes me think also about what Francis was saying before about impact beyond like human-centered design, beyond the direct beneficiary and being more open to the community and the positive spillovers that we also hope disruption has in the current status quo. And I know from previous conversations with Zineth that one of the big challenges that Jamie Life is tackling is the fact that 60% of those who need help with daily living as a result of chronic illnesses have no access to it. But making that service available is just one part of what Jamie Life does. And Zineth, I would love for you to share more with us about how you integrate different actors such as family caregivers, health workers, and patient families to create a benefit for all of them.
Thanks, Eliana. I was listening to Jono and to Francis, and I couldn't help but get goosebumps around thinking of the work they're doing and how applicable it is for us too. So around mental health, we have a patient yesterday who was sort of all medication was stopped and is in the dying process, and they're by themselves. They have a husband who is elderly as well, and really the only support they have locally is our caregiver. And sort of watching the emotional turmoil that the person who's been caring for this person who's now hospitalized but going through the dying process has been heart-wrenching. Another example of sort of, a not direct patient is a few weeks ago, we came to know of a woman who had been caring for her husband with multiple sclerosis, can never pronounce it, and she does that full time, and she just really needed a break. She wrote us the most heart-wrenching intake form, and we went and had a full team of 3 people there and sort of facilitated the care. We just did it for a weekend, and I think my interpretation of what was going on was at a point where, from a mental health perspective, didn't have anybody, limited support. And I hesitate to use phrases because I'm not familiar with the terminology, but I think was just so carried so much for so long that had she not had that break to just get away, we couldn't get hold of her for the whole weekend, which was a problem. But it all worked out okay. And so I think this point on the support for the people who are care providers and who walk alongside patients is crucial. And then, one thing that Jonathan mentioned as well is the technology piece, and it's something that, and I'll come back to the integration of indirect beneficiaries in a moment, but it's something that we've really struggled with, because the reality is that the care providers and the families in our target groups are Black and coloured South Africans, and they exist in a system where the education system has failed them. And so the fact that we're not able to get quality data put into anything we design is not, it's a reality that we live with. And so we use a combination of tools, and WhatsApp is one of them. We also use voice quite often, and then transcribes with some editing that happens. But we're designing for a context that isn't what I think most solutions are designed for. And it's challenging, we iterate, but we move forward. To your question, Aliana, around how to integrate different actors, caregivers, health workers, families, etc. We all know of so many stories where a loved one has gotten sick or may even have passed away, and no one knows what happened. This has happened in my own family. We don't know what the cause of death is. And we don't really have access to the doctors. And I'm a little bit ashamed to say that because I work in public health. But I also know this is not my reality alone. So a report by the National Health Academy of Medicine in the US showed that there's little communication by surgeons and nurses about home-based aftercare for surgical procedures. So family members are at total loss of what to do. They haven't been given an explanation of how to care for their loved ones. And this patient-doctor communication or patient health system communication issue is worsened in our context by overburdened and under-resourced facilities, and not enough healthcare providers. When you think about it, most care is provided at home, outside of a healthcare facility. And that is challenging for policymakers and healthcare system designers to think about, especially in South Africa and especially in the continent where we have so few healthcare providers given the needs we have. And so what we're really excited about is expanding the knowledge and the confidence that health workers and family members have about their own health knowledge, about how to care for their providers, care for their patients or family members, and what this could mean for healthier communities. Sort of we feel that when we have a health worker that accompanies a patient to a doctor and they're able to ask the kinds of questions that you would expect healthcare professionals to engage with, and then they can relay that to family members. And so making sure we provide that loop, we support families, and we're also helping them. So ultimately, they may not even need us because we can't be there for, physically be there for every family and every patient. And we track this, including emotional well-being, and we share progress reports to make recommendations so that doctors can see that, families can see that. And hopefully this informs better care for the patient over time.
Thank you so much, Zina. What I'm hearing from the three of you, it's like, I think the main takeaway from me up to here is the solutions basically are things that we wish we had at some point in our lives, experiences that we hope, or resources that we hope were available for us. And also our hope is also that these solutions are not needed in the future. So we're responding to an actual problem, and I think that's so valuable, and I would love to keep talking with you all day. I will move to take questions from the chat box. Please keep them coming, but first I'm going to address a question from CG up to Jonathan. So how does same deal with the generational gap around concept of orientation, identity, and mental health, when much of languages is this language is not something that African parents, guardians, and grandparents have any prior exposure to?
Thanks so much for that question. Was that from C-Claire? Thank you, C-Claire. Yeah, it has been a challenge for us. One of the things we've been trying to do is to work with local young people to focus not so much to adapt the content so that it doesn't so much focus on identity, but on tools and tactics to be happy, regardless of what your identity is. And something that I talk to our team about is we're not trying to teach young people to be gay. We're trying to teach them to be happy, no matter who they are, even if the way that they want to express themselves, the relationships that they want to pursue are different from what their parents and their community had in mind for them. And one of the things we're trying to do is to create and collect stories from young people who have found a way to communicate with their families, or at least to reach a kind of truce with their families, about their identity and their relationship. In some instances, that's just not possible. So one of the things which we are not doing, which is quite different from a lot of the approaches to this challenge in the West, is not to insist that young people have to come out, not to insist that there is like a specific way to be trans or to be a lesbian or to be non-binary, and that it requires you to be living out and proud and telling everyone about it. Because in some of the countries that we're talking about, coming out is a very fraught experience, and it comes with some real dangers to your future livelihood, dangers to your physical well-being. You're at risk of violence, you're at risk of persecution, and as I said earlier, in 70 countries all over the world, your identity could put you at risk of legal censure, could mean that you are breaking a law. And so what we've been trying to do with the content is focus on mental health and well-being, achieving your potential, even if you do feel different, even if you are different, even if there's a gap between you and the rest of your family. Not necessarily to start with, what is your identity? Now let's talk about what the implications of that identity are. And this is also important because people's identities are wrapped up in who their family is and who their community is. And I think that the risk of creating content or stories or interventions that aren't located in a specific community is that you're telling young people to reject all of the good stuff that comes along with some of the more challenging things around community, and that's not something which I think is helpful to young people or to families or communities. That wasn't probably the most specific or concrete answer I could have given, but it's the answer that came to me now. Thank you for the question.
Great. We're going to turn to the next question that is for Zenith. So it says, to what extent is the societal disregard, and by this meaning the disregard in the sense that is not seen as valuable for care work and care labor, contributor to this mental health burnout you were describing? And a follow-up to that, if care workers were paid more, could we see that they would be better equipped to access healthcare services without worrying about missing work?
Access. So I'm going to start with the second one because that's actually a big issue. Actually, both of them are big issues, but the second one is top of mind on them accessing health services. One thing that we have found is that all of our team members and a large percentage of the family caregivers we support suffer from some chronic illness, hypertension, diabetes, etc. So they have to go to the clinic. And for our team, we've structured it in a way that they can go and they can come and work in the number of hours at another time. And so they're not missing a day of work. And that helps us a little bit operationally as well. But it took us a long time to get there because initially we wanted to approach it as this is something that they must do. It's not something they want to do. They're not taking the time off work, etc. But it wasn't fair because some people have more healthcare needs than others. And so there was ultimately a discrepancy between those that had more sick days or more time off work for this than others. And so we think that the way we've worked around it helps. So I think that, yes, higher salaries would help. I think that would help a number of things. I think the challenge, though, is that there are so many things about the communities that the caregivers live in, or in general, I think Black and Coloured communities in the Western Cape where we work, that they're much more predisposed to these chronic illnesses. The research is 3 to 4 times more likely to suffer from the ones I mentioned, hypertension, diabetes, etc., if you live in a coloured or Black urban area in the Western Cape. And that just really sucks because it impacts the quality of life for them in addition to the care that they can provide. So it's not a clean, it's not a nice solution. But I think it's working and works for them. And I think it's something that everyone should. It's sort of what white collar workers have available, and so why not, right? To the first point on the value of caregivers. So we think about caregivers in 2 different baskets. The one are those who are professional, and then there are family caregivers. In terms of the ones that are professional, and I see this on a day-to-day basis where the women, it's really interesting because the women we work with, when you put them in a professional environment, they walk around with their shoulders down. They don't come into a space knowing to the point that they are so significant in this work, and the work that they do is often work that others can't do. And so what we're trying to do, I think, from an organization perspective, is make sure that there isn't the hierarchy that they would have elsewhere. And so they are making decisions with us around leave policies, around technology, around compensation, around governance, etc. Because they play those roles in their communities, in their churches, and so on. And so that's helping. We're being intentional around the spaces that we use for our team, because I think often when you grow up as Black or coloured in South Africa, and I'll speak as coloured South African, there are spaces that you still don't think are for you. And so when we do, not extravagant, but when we do team things, we make sure we do it in spaces. And that's been really interesting to watch people's reaction to. And then, of course, practically, we make sure that people are paid. And we make sure that where there are family caregivers, that they know the value, they know their value. So even if they're doing a service for a neighbor or another community member, we pay them for it. And we think that that's helping to baseline the value, even if they're not earning a large amount. But then people, sort of the person who might be paying for, in my family context, for instance, I helped with some bills, and another family member did the caregiving. But because we're now paying the caregiver, it helps equalize things a little bit. So I hope that answers. I think this point on the value of caregivers is something that we don't really know. We're trying different things. We're starting a campaign now on celebrating caregivers, celebrating family caregivers, that we want to roll out in communities and just tell the stories in a really positive way. And so we're hoping that will help. But we're sort of learning as we go along. Thanks, Anya.
Thank you, Zineth. And we're going to address the last question in the chat box before we go into breakout rooms. And this one is for Frances. So the question says, how do you select what content to make available on Colibri? And how do you find content that is culturally appropriate and relevant?
Okay, thank you very much for this question. The curriculum that we are putting together, we are working with stakeholders like the National Curriculum Development Center. So the curriculum that I'm putting together and the content is aligned to the requirements of the abridged curriculum, which has been put together by the National Curriculum Development Center of Uganda. And so it is to the age of these learners. And what I do, I go into Colibri and look at the content that fits the learners, that is in line with the abridged curriculum that has been put together by the National Curriculum Development Center, which works closely with the Ministry of Education Uganda.
Thank you, Frances. Now, to keep this session moving, we're going to go into breakout rooms where attendees are invited to keep this conversation going and ask questions directly to our amazing panelists. And then we'll come back at 5:15 to do a wrap up, and we'll all close the day together. Melissa, please lead us to the breakout rooms whenever you're ready. Welcome back, everyone. I'm going to go ahead and wrap us up. So, in this session, we have been talking about the importance of human-centered design to think with and for the community you're serving, about how technology is so powerful, but ultimately a tool that allows us to democratize access to mental health, to education, to dignity, recognition, and ultimately to connect. In the chat box, you can find the contact information for the panelists, how to know more about their innovations, and the best way to keep this conversation going. Thank you, everyone. It has been lovely and such a pleasure to share this session with all of you and these amazing panelists.
Thank you, Ariana. Thanks, everyone.
Thank you.
Bye.
I hand it back to
I'm trying to remember how to do it.
How do I exit?
Cynthia, do you want to close us out?
Okay, so what we're going to do in the absence of CFA is I know I see this some people still in the room, so I want to thank everybody for. So maybe you put my camera on, Mel, and just thank everybody for being here and joining us this week for our sessions, for virtual sessions. Next week we begin with our in-person sessions in Tumloho, Johannesburg. So if you have not registered, please do so. Go to our social media platforms. We have all the registration details. Our website has that as well. So do register for that. If you're going to be in Johannesburg, please do that and join us next week from the 25th to the 27th of October. We will be having our in-person sessions. So do check out our social media platforms, our websites, to see which sessions you may be interested in. As we close, I will play us out with some sounds from Sipuya Moya. So thank you everybody for joining us. It's been a great session.
Ay, 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 ao shaiza ta pesulu, kiti shaiza ta pesulu, asa Ah, Dago. Akiriveke lalelo. Ngithengisa mbele dolobheni nangu ubabe umile ayibona iqonda ukuthi ume nomunye usisi nakungikilwe mini ngase ngithi ake ngisondele kubhizi kuhle kwamahlaya sathani ngikushiye ekhaya ufuna nilana nakho ngizovukela ukuhlala dali wami elukhuluma iqiniso kimi dali vala umlomo ngikaze ngikushaye dali wami elukhuluma iqiniso kimi awiqiniso kimi dali dali wami elukhuluma iqiniso kimi dali dali wami dali wami elukhuluma iqiniso kimi dali dali wami aleqaleni mazokhuluma nami wehlisa izwi moya phansi ayikhanda lakho wena kuduma inkani lalela izintombi ziningi yeke uziqede wemfana abantu vele uyeke yavuka ngephanda mina ngasebenza ngizunethezekile wenele wayibodombolo thina sikhwele sikuthwele manje sikuthwele ngafa ngafela ubala ingabe yini ngabe qomelani dali wami elukhuluma iqiniso kimi dali 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 asaba ngithi dali wami elukhuluma iqiniso kimi dali dali wami elukhuluma iqiniso kimi dali dali wami ayibo angithi shaya izandla phezulu angithi shaya izandla phezulu shoda phansi ayibo siyabonga kakhulu bafethu Siyabonga kakhulu bafethu for having us. This was fun. Again, it was pure moya lo and catch you on the flip side.